Welcome back. Now, health stakeholders are calling for increased investment in cancer treatment in the country. Led by the Kenyan Network of Cancer Organizations, Executive Director Phoebe Ongadi, players in the sector warned of the rising burden of the disease, which they say continues to expose the country to a public health crisis. The clarion call was made during a media engagement ahead of the second National Cancer Summit, slated for the 27th to 30th July.
The prevalence of cancer disease is on the rise, with the National Cancer Institute of Kenya recording 44,000 new cases annually and approximately 27,000 resultant fatalities. These are not just figures, they are a harsh reality of a looming public health crisis, which according to the Institute's CEO, Dr. Elias Meli, require urgent and concerted efforts to arrest.
In our farms, in our communities, we need to have very dedicated strategies to make sure all the chemicals that have been identified to have carcinogenic effects should be banned.
Take screening, early detection, prevention, diagnostics, treatment, palliative care, and survivorship to the next level.
Stakeholders in the health sector who met during a media engagement forum in Nairobi, however, cited the lack of sufficient financial resources and the infrastructural capacity allocated to the cancer treatment in the country, which is a big setback.
Are there equipment that they need? Is there infrastructure? So we need the concerted efforts, not just from the National Cancer Institute and the Ministry of Health, but the county governments should also move in because health is devolved.
The stakeholders called for a review and expansion of the Social Health Authority's oncology benefits package to meet the growing demand for quality and affordable cancer care.
The Social Health Authority and the Social Health Insurance Fund, on paper, it is magnificent. In fact, on paper, it is supposed to cover the whole continuum of cancer care, right from diagnosis to treatment. So we are still urging the government and urging the ministry to please go back to that paper, what is enshrined in the Social Health Authority, and ensure that it is actually what we are seeing on the ground.
Cancer survivors who attended the event advocated for heightened community sensitization to dispel myths surrounding cancer and alleviate victimization during and after treatment.
Are we best in stigmatizing? Because basically, I'm known by some of you here as Mama wa Matiti Moja. And for me to take that name, it was not easy. Can you imagine, as you walk around in your area and people are saying that, ule mama ni Mama wa Matiti Moja. Hey, tunamkamte masiku. And then they start. By the time we are, everybody, all the eyes are in you.
We have to engage our patients as active partners, and we have to manage them in the entire healthcare continuum, whether it comes to primary prevention, secondary prevention, or early diagnosis, when it comes to the aspects of diagnostics, when it comes to treatment, and also survivorship, palliative care, and end-of-life care. We have to involve our patients.
The summit will seek to review the progress in cancer prevention, detection and treatment, and the national coordination efforts in the country. John Kahiro, Prime Edition.
National